You're listening to In Good Health from Radio Health Journal, the trusted news source for medicine, science, and technology. I'm Elizabeth Westfield.
I'm Mayan Vasta Betancourt.
And I'm Greg Johnson. This week, why aren't we better prepared for natural disasters?
It's one of those things where people think, oh, it could happen to you, but it's not going to happen to me. And that is a very dangerous place to exist.
But first, can acupuncture help patients recover from open heart surgery?
We know that heart disease extends well beyond the heart, so I just love it when therapies and treatments address the whole person.
All that and more this week on In Good Health. More than 800,000 people in the U.S. have a heart attack each year, according to the CDC. About 500,000 undergo open heart surgery. And while both of these events are terrifying and risky for patients, that's not the end of their journey. Dr. Kim Feingold says patients can often experience significant anxiety and depression that can further stress the heart.
So we know that stress, anxiety, and depression can have negative implications on cardiovascular functioning. We know that their mood is impacted. So 20 to 40% of patients after open heart surgery will experience symptoms of clinical depression. Up to 30% of cardiovascular patients can experience symptoms of clinical anxiety. And we also know that patients can experience symptoms of post-traumatic stress. And then general stress, well, it's not specifically a medical or psychiatric diagnosis, is also very common and can impact cardiovascular functioning.
Feingold is an assistant professor of surgery and psychiatry at Northwestern University Feinberg School of Medicine. She says it's not well known why people have an increased risk of clinical depression after a heart attack or surgery. However, the current ongoing research is looking at how physical behaviors factor into this risk.
If patients aren't necessarily able to engage in exercise or activity so much after a heart attack or after heart surgery, but there appears to be a lot of the variance, at least 50% of it, is due to physiological mechanisms. And so whether there is a mechanistic pathway that's related to inflammation or to physiological arousal or sympathetic arousal, there seems to be some physiological reasons why individuals are at increased risk for depression. And also there seems to be similarly physiological reasons why those who develop depression experience worse outcomes and greater risk of cardiac morbidity and even mortality.
Which is why Feingold says it's crucial to educate patients, not just on these statistics, but on the symptoms of depression, so that they can be treated before it leads to something more serious, like death. Feingold's the founder and director of cardiac behavioral medicine at the Bloom Cardiovascular Institute at Northwestern. Part of her job is finding creative methods of treating the whole person instead of just the heart. She recently worked on a pilot study published in Perioperative Management to determine if acupuncture therapy could be one of these integrative treatments. While it hasn't yet been used after open heart surgery, Feingold says there's precedent for its use in helping patients heal after other types of procedures.
Orthopedic surgeries, gynecological surgeries, and has been demonstrated to decrease patients' need for pain medication, improve their experience of pain, and also reduce surgical side effects such as nausea, vomiting, and so forth. So we just thought that altogether there was wonderful opportunity to examine the role of acupuncture in the cardiovascular setting, specifically after cardiovascular surgery.
Anya Gramone was an acupuncturist and Chinese medicine clinician at Northwestern Medicine for 20 years. She says the practice has been around for more than 3,000 years.
It's made its way in 20th century, probably 1970s. It started getting popularized here in the U.S. In Chicago, it was actually legalized in Illinois in 1997. So it's still fairly new over here.
She says that in the beginning of her time at Northwestern, maybe 1% of patient referrals were from physicians. Now she estimates that that number has jumped to 95%. But even with this rise, there's still a lot of skepticism around acupuncture therapy.
We were the best kept secret on campus for quite a few years. There were a lot of physicians, a lot of people who had no idea that we even existed. So it's been a long journey of kind of climbing out of the shadows. Now, where before it was like, this doesn't work, so there was a lot of dismissal. Now I think the message shifted more towards, I don't know anything about it, it's not going to hurt. So there's a shift. There's still not a resounding, yes, go for it, or promoting it or advocating for it, but there's less resistance to it.
If you're not familiar with acupuncture, it's often described as energetic medicine. The traditional practice uses the meridian theory, in which needles are used to target microscopic strings called meridians.
They're tiny little microscopic vessels that lie inside your lymphatic system, inside larger blood vessels. They create networks around the organs, and they contain microgranules of DNA.
Modern medicine explains these acupuncture points as groupings of nerve fibers.
So when you stick a needle through, you stimulate these nerve endings into releasing a number of different biochemicals, endorphins, so natural painkillers, vasodilators, so they bring the blood circulation to the area. They regulate your endocrine system, so regulate hormones. It's a very measurable neuroendocrine effect as to what happens.
However, Gramone says that while these two definitions have a lot of overlap, the main difference can be seen when stimulating a nerve versus a meridian.
When you stimulate a nerve, I know exactly what's going to happen. If I'm going to stimulate your vagus nerve, I'm going to slow down your heart rate. I know what's going to happen. But if you stimulate the same acupuncture point, can increase or decrease heart rate, increase or decrease blood pressure, increase or decrease movement of your intestines. The body somehow knows how to use the stimulus to its best advantage.
Meaning that acupuncture helps your body restore its normal functioning by bringing attention to wherever it's needed in the body, which is different for each patient. Gramone helped bring this practice to Feingold's study, using daily acupuncture on patients who had just had open heart valve surgery. However, the research looked at more than just patient symptoms.
Our primary goal, since acupuncture has never been utilized before in the hospital setting after open heart surgery, is we wanted to assess if this was feasible. Right? So are patients willing to accept acupuncture therapy after open heart surgery? We know that they're going through a lot. This is a monumental experience in their life. And is it also logistically feasible in the very fast-paced environment? And then beyond that, we were very interested in looking at the outcomes. Is acupuncture going to have an impact on post-operative pain, nausea, stress, anxiety, the patient experience, as well as medical outcomes, including length of stay and post-operative atrial fibrillation.
Atrial fibrillation is an irregular and often very fast heart rhythm that can lead to blood clots and increased risk of stroke or heart failure. Feingold says about 30% of patients can experience this after surgery, which can lengthen their hospital stay. Patients in Feingold's study received acupuncture the day after their surgery and then each day following until they were discharged. 3 licensed acupuncturists, including Gramone, were charged with delivering this therapy.
They came up with these standard protocol that we used for this study that targeted all of the common symptoms that can occur after cardiovascular surgery, including ones related to cardiac rhythms and cardiac functioning, but also things related to pain, depression, anxiety, nausea, vitality, and so forth. So our protocol consisted of about 8 or 9 needles that were placed on the body and in the ear.
And then, because acupuncture is not prescriptive, it's very individualized. We always take into account who's the human in front of us. We would look at what else do they need. And then we would add points depending on if they had anxiety or depression, we would add points for that. If they had pain, we would add points for that. If they had nausea from anesthesia, we would add points for that. So we would modify that protocol by adding things that were necessary.
Even though this is just the beginning of their research, Feingold says that these first results are very exciting. For one, it proved that acupuncture is able to be delivered in such a chaotic environment. Another win was the patient's acceptance of the therapy.
Majority of our patients had no prior experience with acupuncture, indicating or suggesting that they're very open to receiving integrative therapies in this environment. So that was very exciting. Also very exciting is we found that there's significant promise in the role of acupuncture for improving outcomes and patient experience after open heart surgery. And so that was very exciting. Our patients in the acupuncture arm reported less severity of pain, nausea, stress, and anxiety compared to their counterparts who didn't receive acupuncture. They also spent fewer hours in the intensive care unit, about 7 fewer hours compared to those who didn't receive acupuncture.
And then the last, and possibly most important outcome, is that this research suggests that acupuncture therapy could reduce instances of atrial fibrillation after surgery.
So like I said, about a third of patients historically might experience postoperative atrial fibrillation after surgery. And we did find that patients in our standard care experienced a 32.7% incidence of postoperative AFib, but those who experienced daily acupuncture, they had an incidence of 13.7%. So patients who experienced daily acupuncture had a 58% reduction in the incidence of postoperative AFib, which was very exciting. Again, this was a smaller pilot study, but just to appreciate the potential role of acupuncture reducing medical outcomes is remarkable. And we know that heart disease extends well beyond the heart. So I just love it when therapies and treatments address the whole person.
You can find more information about Dr. Kim Feingold, Anya Gramone, and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health on Facebook, Instagram, and X. This segment originally aired in December 2023. Our writer-producer is Kristen Farah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.
In Good Health returns in just a moment. Between the wildfires in Southern California and the flash flooding at Camp Mystic in Texas, America has experienced truly devastating weather events this year. But even though we see some of these extreme incidents every year, Alexis Merdjanoff says that oftentimes local and state officials are still unprepared when tragedy strikes. She feels this disconnect stems from a sense of disbelief that such destruction would actually happen in their area.
It's one of those things where people think, oh, it could happen to you, but it's not going to happen to me. And that is a very dangerous place to exist. It's also something that I think that we do for ourselves to offer some sort of mental health protection, because we can't be walking around thinking all day, every day, what's the worst case scenario that's going to happen.
But we do need people in place who are dedicated to preparing for tragedy. Merdjanoff is an assistant professor of social and behavioral sciences at New York University's School of Global Public Health. She specializes in how natural hazards affect the health of communities and says that we can see this ignorance unfortunately play out with the flooding in Texas earlier this year.
That's an area that floods frequently. People perhaps became complacent that the flooding occurs, but nobody thinks it's going to be that bad. And it happens in Florida. We get hurricanes all the time. I've lived through a ton of them. It's never going to be that bad or the one. But then the one happens. And so I think that is the disconnect, is that people understand that this is a possibility, but they're not preparing for worst case scenario.
America does have national guidelines that discuss 5 factors, including prevention, protection, mitigation, response, and recovery. However, Merdjanoff says there isn't the same comprehensive framework that targets mental health recovery.
Disaster recovery often uses what some researchers call as fantasy documents. We have plans, we know what we're supposed to do. People put in a lot of work to coming up with different programs, stages, but when it actually comes to the disaster itself, those plans can kind of be shelved or put in a drawer and not really referenced.
Or if they are, it's very possible the plans are out of date.
One of the challenges is that disasters, we don't know when they're coming, right? So sometimes we might plan for the next pandemic, but then the next pandemic doesn't come for 10, 15 years, and the plans are outdated.
The good news is that Merdjanoff and other researchers have been analyzing past disasters to see where mental health recovery programs can be better. One tactic she's happy to see being utilized is having open communication between states to workshop the most effective approach together.
So I'll give an example from Hurricane Sandy, which I think was an excellent thing that a lot of the state health officials did. Was they said, okay, our state is dealing with a disaster that's unprecedented. We haven't experienced this in New Jersey before. It wasn't that long after Katrina. And so what they did was they went to officials in Louisiana and Mississippi who had dealt with Katrina recovery and said, what do you think our population might need? And to hear that from people who had already lived through it and could say, hey, this is what worked. This is what didn't work. This is what we should have done. Here were some of the gaps. And then the New Jersey officials could come together and say, okay, this is what we know. And we know our population and who we need to be serving. And these are the kinds of programs that we need to put in place.
And though they worked hard to provide effective mental health programs, Merdjanoff says one of the biggest challenges is timing. Oftentimes, people aren't ready to address their internal struggles until well after the rest of their lives are put back together after a disaster.
They will initially try to get housing, try to make sure their kids are in school. If they're looking for employment, if they need to maintain employment, right? They're dealing with those more immediate needs. And then maybe 3 months, 6 months, a year later, when they're sitting in some relative normalcy, they'll say, oh my gosh, I'm actually experiencing some sort of anxiety. I'm a little depressed. I'm not sleeping well. And they need those services, but all the programming has come to an end.
She says that in many recovery cases, the funding is set up to provide all services up front. However, she argues that the mental health services need to be restructured to be available when the community actually needs them.
A lot of it is set up for that 3 to 6 month period after an event occurs. And if I have learned anything over researching these events the last 15 years, is that that is not sufficient. We need programming that can last for years, essentially. It could be that people only need help for a few weeks. They could need help for a few months, but it could be a year or 2 or 3. And it depends, again, on the severity of the event, the type of event, where it occurs. But a lot of these recovery programs are kind of front-loaded to immediately following a disaster.
Unfortunately, the physical and mental recovery takes a long time. It's an ongoing process that works at its own pace. Because of this, Merdjanoff believes that if there's only enough funding for a few months of mental health programming, they should start later in the revival process, depending on the community's needs.
An event where people are trying to get their housing together, they're trying to get their kids in school, regain some sense of normalcy, and then it's, oh, I need to tend to myself and my mental health. And that is way further down the line. So if we know that that's the case, can we push the mental health recovery programming maybe 6 months out if we don't have sufficient funds to let those programs run for a year or 2?
Having good mental health is such an important aspect of resiliency. In Merdjanoff's research, she's seen how populations with high resiliency tend to recover faster and come back stronger as a group.
And we've seen that a lot with Katrina, with Sandy, when you're thinking about communities that were able to recover at a faster rate. It's because they had this social cohesion in place.
But in order to have this strength in the face of tragedy, she says that it needs to be fostered before disaster even occurs.
And by that, I mean strengthening ties and cohesion among community members so that when a disaster happens, people already have relationships in place that they can turn to when it comes to recovery. A lot of the knowledge that you need in order to recover, whether it's figuring out how to deal with insurance providers, knowing where to get hot meals, finding out that you're maybe eligible for some program that you hadn't heard about. That's a lot of informal knowledge sharing. And you get that from other people who are going through the same disaster.
Merdjanoff says this strong community can be achieved through investing in social infrastructure, like libraries and organizations where people can meet each other.
Doing that ahead of time, investing in that way, which may not necessarily be tagged as disaster preparedness, it's really community building, but it serves multiple purposes. And I think the return on investment is pretty good because it helps not only with recovery, but it helps with health. It helps with mental well-being. It helps with knowledge sharing. And people are happier when they're actually out interacting with each other. So I would like to see greater funding given to social infrastructure. I'm not saying don't invest in physical infrastructure, but can we put a little bit more into the social side of things where we know long-term that there are really high payoffs.
You can find more information about Alexis Merdjanoff and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health on Instagram, Facebook, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.
In Good Health returns in just a moment.
Medical notes this week. Could birth control be affecting your brain? Millions of women use hormonal contraception, and new research is showing it may be affecting more than reproduction. Research in the journal Hormones and Behavior shows that contraceptives seem to affect brain processes that are responsible for emotions and memory. The paper has connected that birth control appears to influence how women experience emotions and remember the emotional event later. You'll never guess this sneaky cause of air pollution. Though wildfires and dust storms aren't great for our health, droughts are a main driver of the polluted environment in Latin America. Nearly half of electricity is supplied through hydropower, but when there's not enough steady river flow, these areas are forced to switch to fossil fuel. These processes release harmful particles that lead to heart disease and breathing issues. The research is published in the journal Nature Communications. Is inflammation ever helpful? Though it's often the cause of various diseases, a study published in Cell Reports shows that inflammation can be protective in the brain. Scientists found that a molecule called STING, which aids inflammation, may be necessary to keep the brain healthy as we age. However, it's a finding that contradicts earlier research saying that STING needs to be blocked in order to treat age-related brain decline. And finally, are you eating the right type of protein? Consuming protein after a workout is important for muscle recovery, but new research shows that the type of protein matters too. The study, published in the journal Nutrients, reveals that pork-based protein is better for your body than vegetarian alternatives that don't have as many amino acids. And that's Medical Notes this week. I'm Mayan Vasta Betancourt.
Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website, inbetterhealthpodcast.org, or wherever you listen to your podcasts. Follow us on Instagram, Facebook, and X for more behind-the-scenes content. Tune in next week for another edition of In Good Health.